Good evening. This is Dr. Holly Gunn, board certified dermatologist and master's in public health. I have a lot of friends calling me right now. How am I supposed to deal with my skin, especially all this stress and all of this stress acne? So I thought I'd do a little video of how to pinpoint your stress acne and spot treat it and not let it get out of control. Definitely do not become a picker in these coronavirus times. So the first thing that I'm going to do, I'm going to cheat. I am a dermatologist, so I get to use prescription medicines, but you can get benzoyl peroxide over the counter. So I've got a benzoyl peroxide clindamycin combination. This is prescription. It's Onextin. There's a lot of generics out there as well. You can even just get a benzoyl peroxide product over the counter. Now, my pet peeve with benzoyl peroxide is that the longer it sits on your skin, the more it dries you out. And it literally works on contact. So I like to get a little benzoyl peroxide, put it where my acne zone areas, and right now I'm having stress acne. You can even see I'm a little red underneath my nose, and that's acne. Because yes, even as board certified dermatologist that has 4 kids, we do get acne, and I've got a little bit right there. So I'm just putting benzoyl peroxide where I get acne. I'm not letting it sit on my skin for very long because then I'm going to use a gentle cleanser to wash it off. So I have one of my favorites. It's called Simply Clean from SkinCeuticals. It's a mix of alpha hydroxy and beta hydroxy acids, but nothing too strong, so it's still very gentle. And now I'm going to wash that off. All right, and now I've got my face all clean. I am going to use a little blue light device that I got at a dermatology conference. Blue light decreases inflammation, and you want to let it sit on the acne for about 30 seconds to a minute. So I'm going to hit this little guy right here. And take my little blue light, put them right here. This decreases inflammation. So acne starts as inflammation. It secondarily gets complicated with bacteria, which is why benzoyl peroxide works. While I'm doing this, I'm going to mention my pet peeve. I actually just used one of my favorite washcloths to dry my skin off after the benzoyl peroxide. Now I know I'm safe because I rinsed it off pretty good, but benzoyl peroxide bleaches things, which is another reason why I don't like to have it left on the skin. So if you're using a benzoyl peroxide product and you don't want to ruin your really expensive, nice washcloths, just use a white washcloth. And I had a little guy up here, so I'm going to put that blue light on there, 30 seconds to a minute. I move it around because this one's pretty small and I can never tell if I have it exactly on my acne or not. So you don't want to let it get in your eye. It can kind of like give you the little stars in your eyes afterwards, so because it's a pretty strong blue light. And Hydrofacial has these. I haven't had a Hydrofacial in like 3 weeks because of this COVID stuff, which you can tell on my skin, it's not nearly as glowy. I love Hydrofacials. I love Diamond Glow, which both of those are very gentle chemical peels that have some suction with them too. It helps me control my breakouts. So without it, because I'm supposed to be stuck inside, even though I had emergency patients today, but I did not want to stick around in the clinic even just to get a Hydrofacial done. So that should take you about a minute to do. And then you want to spot treat. I layer my spot treatment. So if it's acne that's more due to rosacea, because I have both. I have acne, especially stress acne, and rosacea. So if I think it's rosacea, I'm going to use this Finacea. This, again, cheating. This is another prescription that you can get from your dermatologist. It's actually a foam. So I'm just going to spot treat my acne because that acne on my forehead is actually more of my rosacea than my stress acne. But all of this around my nose and my chin is my stress acne. So I have Finacea, which is an azelaic acid product for my rosacea. I don't really see much more. And then I have a salicylic acid. This is a My Body Glow Biotic product that's salicylic acid. They mix their salicylic acid with a bunch of anti-inflammatory, like natural ingredients like tea tree. I love antioxidants. The more they throw in there, the better. So I'm going to put that on the areas where I'm getting my acne too. Now, salicylic acid really does open up your pores a little bit, and I get nervous anytime I talk with a patient about extraction. So I do think extractions should be done by professionals. Do I have my own? Yes, of course, because I'm a dermatologist. And but I know when you extract, and again, I just use salicylic acid. Even my cleanser had some alpha and beta hydroxy acid, so my pores should be open a little bit. When you extract, and actually this one is a Schomburg comedome extractor. You can get them on Amazon. Oh, I hate saying that though, because please do not overdo it with these, even though these are so fantastic. And then I have another little one. You can get these on Amazon too. I ordered mine from a medical supply company. But I have seen these online. So some of the little stuck ones, this little sharp guy, you can kind of like nick it real fast, but it should be like a little boop and done, boop and done. It shouldn't be digging into the skin. It really should be like, I don't even want to say scratching the surface. It should be like where you can see the pore and you're going right inside the pore if it's plugged. But you really want to use ingredients to unplug your pores, not like be scraping it with a comedome extractor, because you're going to cause inflammation with this if you overdo it. But it is great because like once it's kind of like unroofed, you can go boop, done, boop, done, boop, done, boop, done, boop, done. If you're in the mirror for more than 3 or 4 minutes doing your routine and you're in the mirror for 10 minutes doing this, you're doing it too long. You're going to get red and irritated. You're going to get more inflamed, and inflammation like wildfires spreads, and you're going to get more acne because you're spreading that inflammation. So it should be a little boop and done. This should take you 30 seconds over your entire face. Do not overdo this. So now that I've got my salicylic acid in there, I want to lock it in with a sulfur product. And I'm actually going to grab another prescription. See, I'm a cheater. I've got some Axone. I love Axone. It's supposed to be a once a day all over for adult female acne. I love it. Yes, I just put salicylic acid. My salicylic acid is already dry, but again, we're going to lock it in there. I'm going to put Axone on top of it. You can't mix Axone with benzoyl peroxide, but guess what? We took our benzoyl peroxide off because we don't like to leave it on the skin. So I'm going to do my Axone spot treatment too. Axone decreases inflammation. Some people call it topical Dapsone because that's the generic name. And then I'm going to take my Glow Minerals. It's a sulfur, zinc, and tea tree mask. Love all of those ingredients for acne. And I'm just going to dab that on there. And my husband's not home yet, so I can look like an idiot for like 15 minutes. Sometimes I do this right before bed and I just let it stay on there, and it's all gross and it's all goopy. And because with these masks, you can do them all over if you have acne all over, but I love sulfur mask. To just lock those other good ingredients in there, and that way they go away. Literally some small acne, I can see them go away with this treatment, and I don't see them anymore. Some of the larger ones, it may take 2 or 3 days. If they stayed on my skin for 2 or 3 days, I'm gonna have one of those red marks, and I just IPL that right off in the clinic. So this is it. This is what I'm gonna look like silly for 10 to 15 minutes, and then I'm gonna come cleanse it off, and I'm going to put a moisturizer on. I usually do my nighttime routine, which is anti-wrinkle. We can get that at another time because I could literally talk about that for hours. I put my aftercare on, especially since I scratched some of these accidentally throughout the day with my stress. So I'm going to put some Neocutis aftercare on, but just any moisturizer that's full of antioxidants will help decrease the inflammation of the skin, and you've done most of the spot treatment part. And you can do this because I didn't do anything that's going to dry me out and irritate you. I could do this 2 or 3 times a day if I wanted to. I mean, that's the key. When you're spot treating multiple times throughout the day without squeezing, picking, rubbing, and this will make it go away faster, and you're gonna have your acne get gone in a day or 2. Again, some deeper cystic ones, this is not gonna get it. If you have deep cystic acne, you need to come see us. But this should get rid of some of those more superficial ones within a day or 3. Thanks for listening.